Hi, I'm William Small, Jr., MD. I'm a radiation oncologist at Northwestern Memorial Hospital at the Robert H. Lurie Comprehensive Cancer Center of Northwestern University. I'm also a professor of radiation oncology. And here at Prentice, we primarily treat women's cancers, both breast cancer and gynecological cancer, although we also treat other forms of malignancy here at this radiation facility. And I want to talk a little bit about innovative techniques for radiation oncology. We have a number, one of which is called Intensitymodulated Radiation Therapy, abbreviated IMRT. And basically it's a way to formulate the radiation to precisely deliver it to the areas we want to treat and miss as many other areas as possible. We don't use it on every patient, but in patients we need it, we have the capability, and it offers another unique tool for which to target radiation safely. The other unique innovative aspect of our radiation oncology department is something called intraoperative radiation. Intraoperative radiation is a technique where we actually deliver radiation at the time of a lumpectomy. So the surgeon takes the tumor out, and then we deliver the radiation to the lumpectomy bed. And in certain patients, that's all the radiation will deliver. So we've taken 6.5 weeks of radiation, which is what we typically deliver, and treat it with one fraction at the time of surgery. And we continue to develop that program, and I think for certain patients that's a very compelling treatment to deliver. Other innovative aspects we do is we have the capability on our radiation oncology machines to take both X-rays and actually CTs at the time of radiation to help precisely define how we deliver radiation. Again, it's a technique we use on occasion, not very often, but when we have to, we have it, and it's a unique capability. We also do a number of research studies. Research studies are studies where we're looking at newer, innovative ways of delivering radiation or ways of combining radiation with different therapies. One of which we're looking at a randomized trial, which is a flip of a coin trial, between radiation from the outside for about 6.5 weeks versus radiation for 1 week just to the area where the surgeon took the tumor out, something called partial breast radiation, which is similar to the intraoperative radiation we discussed. We also have a unique trial where we take patients who have ductal carcinoma in situ and again do a flip of a coin trial whether they get a drug called transducimab, which is a drug we use frequently for invasive breast cancer. We do a number of interactive studies also with our medical and our surgical oncologist colleagues and work very closely with them. The medical oncologist, surgical oncologist, and the radiation oncologist, along with radiology and pathology, meet at least weekly to go over cases we think need to be discussed, and we work in a very multidisciplinary manner. And I do encourage anybody who comes to the Lurie Cancer Center to discuss with their medical, surgical, or radiation oncologist new trials or new innovative techniques for treatment. We're more than willing to share that and more than willing to discuss anything that people have to discuss.